Hello, my name is Dana Gammy, and today I'm going to be talking about internal parasites of horses in North America. Most of the parasites that infect equines reside somewhere in the gastrointestinal tract. The importance of these parasites varies depending on each. The outline of today will go through each of the main parasites that affect equines, their clinical signs, diagnosis and treatment, and also the human health importance. First, we'll start with strongyles. The adults are ravenous blood drinkers and can cause anemia, weakness, diarrhea, and damage to the intestinal lining. They are considered one of the most dangerous parasites of horses. The larvae can migrate to the branches of the intestinal arteries where they can cause damage, irritation, and aneurysm. Blood clots can also form, which then can migrate, causing issues such as colic or lowered blood flow to the intestines and legs. Not all dewormers are effective against the migrating and immature worms. The large roundworms, also known as ascarids, are another parasite that concern horse owners. They are large worms that can grow to between 8 and 10 inches in length. The damage they cause is through their migration of immature worms. This migration throughout the body to the liver occurs after hatching in the intestine. Once again, they migrate through the body to the lungs, are coughed up, and then swallowed. They reach maturity after being swallowed. Lung damage can be extensive, and pneumonia can result from the migration. Impaction colic can also occur if a large infectious amount is present. Threadworms mainly affect foals, and infection is acquired through larvae present in the mare's milk. The foals can become severely infected by 2 to 3 weeks of age and can exhibit diarrhea, indigestion, and failing to put on weight. Pinworms, as adults, live in the large intestine and rectum of horses. The females will migrate and deposit eggs in the anus. The hatching of those eggs cause severe irritation and itchiness of the affected area. A sure sign of this is tail rubbing, which, if happens too often, can cause even more irritation and secondary infection of tails, anus, and skin. Horse bots are not worms, but actually larvae of flies. There are 3 species of bots in horses which are the most common: horse bot, the common horse bot, the nose bot, and the throat bot. Female flies will lay their eggs on the hair of the horse. When these eggs hatch, they attach themselves to the mucous membranes of the laying site. They then penetrate and burrow for a short period of time. They become fully developed after 11 months and eventually will pass through the intestine in the feces. These bots are nutrient robbing and can cause death in cases of heavy infestation. Some clinical signs of being infected of a parasite include poor growth, weight loss, decreased feed efficiency, colic, diarrhea, pneumonia, and death. Diagnosis of these parasites vary depending on the parasite itself. The strongyles can be diagnosed by a fecal flotation or necropsy if the animal has died due to this parasite or another reason. The ascarids can also be diagnosed by a fecal flotation, necropsy, and also through their clinical signs, which consist of pneumonia, potbelly, poor hair coat, and weight loss. Threadworms can be discovered by a fecal exam for larvae. The eggs are rarely seen. The diagnosis of bots can be done through visually seeing the eggs on the hair and mane, and also endoscopy of the stomach. Necropsy, and knowing the environment of where the flies live. Treatment and prevention include treating with pharmaceuticals of antihistaminic compounds. The botflies are resistant to most compounds except for ivermectin and milbemycin. Prevention is much more effective in proper sanitation of stalls and areas where the horses are around, and also waste management. When in a pasture where manure pickup is not available, frequent mowing and rotation of pastures is one way to manage. For strongyles, there are few measures that can be taken to prevent infection. Avoid overgrazing, ensuring a clean pasture for young foals composting manure, and more importantly, using effective wormers routinely are the best options. Ascarid eggs can live in the environment for many years and must be taken care of through proper sanitation of equipment and stalls. The public health importance is mainly economic. It can be straining financially on farms where horses have become infected or there are a lot of horses infected. And also zoonotic diseases. It's not super important for the others because they aren't zoonotic, but the bots can infect humans if the females lay their eggs on the hair of humans. Through education and prevention, disease caused by parasites can be greatly reduced. Parasites can cause severe damage to an animal's health. They also cause damage economically to those raising and using businesses for horses for business and income. They can also affect humans via zoonotic diseases of the bots, for example, and can be transmitted via contact with the horse, consuming infected meat. Proper sanitation and routine worming with pharmacological products are the most effective modes of prevention. And thank you very much.